secured an amazing rank 28 in INICET November 21 session. Heartiest congratulations, Aishwarya. How do you feel, bacha?
I am feeling quite amazing. The feeling
Yes.
that can.
And this is an amazing rank, and we were just talking about it that this is his first exam ever for PG entrance. Am I right, Aishwarya?
Yeah, ma'am.
So does it make you feel good that whatever you have done, it's sort of has worked out and you've secured an awesome rank in a very prestigious exam? Yes.
Yes, ma'am.
That's absolutely wonderful, Aishwarya. And Aishwarya has been a 3 year student with us. And now, Aishwarya, what I want you to initially begin with is a brief of your summary or a summary of your journey as of when you started and what are the main things that you did. And now that you've reached the other side, you know, uh, do you feel that starting early really helped you, reaching the right place at the right time?
Yeah, the journey basically starts right from you get inside the college. My aim from the first year was to just understand the basic, and then I will prepare fully, devote full time for the PG from in my
Right,
last 2-3 years. So in the first second year, I was just trying to get the basics, not
right,
studying, not too much hours, just trying to get the basics so that I can, if I read it again in the final year for the PG, I can understand it easily. So then I started. Then the full preparation started from eighth semester
okay.
when uh, when I devoted my full time. I tried to devote my whole time to the PG preparations along with the profs, and
Yes.
after the after the profs, we have just got 9 months because of the COVID. Our profs
Right.
get just late, so we have just got 9 months for preparation. So we have to manage in a bit of a hassle. We are also village posting in between in 3 months village posting. So
Yes.
quite tough to manage all these things.
I am sure it wasn't an easy phase, and juggling everything together is not easy at all. But I think you did it just the right way, so that you are able to reach where you really wanted to. And now, since you've been talking about starting early and building concepts, can you highlight the your juniors or people who are listening out to you right now that how important is it based on the new pattern of exams that you learn the integration, you learn how to connect the dots, have your concepts right? Because if you see even the questions in INICET or in other exams as well, they're not really asking you vague things. So it is common topics, but how they put the options is more twisted. How they're trying to confuse you between options is more difficult.
Yeah, the question will be not like just like directly it's line written from the book that you and your written notes that directly the line will come. You have to
Yes.
analyze it, interpret it, or you have to get the diagnosis, then get to the treatment and what are the possible diagnoses. Means the thing that you learn in all the 5 years. You have to get to that. You have to. This is the pattern is now integrated pattern. They try to
Yes.
integrate in the subjects, so it's quite important to understand, and then you can just mug up. You have to understand it right from the start, and then at the last 1 month, you have to just mug up things. There's no much time to understand the last 1 month. Even if you want to understand, you have to just mug up things. So you have to build
True.
it from the start that you have to understand it, and at the last time you just mug up things.
Yes, I think you're absolutely right that understanding is super important, and that's what your goal was, at least initially to begin with. But Ashwarya, I also want to ask you, you said you were quite mentally prepared about the exam when you reached your final prof, right? So I want to know that towards the end, it is not really possible to go back to all the books that you might have read. Hannah, so how important do you feel is consolidation of things? I'm sure concepts, yes, once done well and once they are good, you won't lose them. But yet, there is a lot of content when we talk about medical science. So, how do you think you maintained a summary of it, or do you think making notes really helped you towards the end when it was not really possible to go back to books all over again?
Yeah, the main challenge in the INICT exam or any other PG exam is that you have 19 subjects. You cannot
Yes.
learn, you cannot just revise every subject. You have to make it concise. So you have to
Yes.
know which topic is strong, then you can do it very easily. Even if a tough questions come in, which subjects you are weak and you think you have to revise it once, you have to write once or twice before going to the exam, and to just not write that. So it's a topic from them, because you can't revise the whole subject. And minors are important. So in this INICET exam, there were many questions from minors subjects, and in
Yes,
minors,
that's true.
smug up things. You can't understand that subject. This the thing that you have to learn, that this looks like this. You have to just correlate with it.
Yes. And when did you start practicing questions, Aishwarya, and how did you keep the balance between theory content and MCQ practice?
I started practicing question after my prof began from February of this year,
Okay. Okay.
and um yeah, then the theory I read the questions. Then after 1 to 2 days gap, I try to do the questions of that topic. Doing
Okay.
immediately after it is not much benefit, because it's just like, it's very easy if you are doing just after the doing the theory. Okay, then you should remember. Then you also try to कि तुम क्या भूल जाते हो, तुम वो पता चल जाएगा. And
True.
I do questions after 3 to 4 days.
Okay. And what about grant test, beta? वो कब देने शुरू किए थे?
I gave my first grant test in August. I
Okay.
tried in the month of August. I gave around 2 grant tests. Then next month I gave 4 grant tests, and then from next month I, मतलब 3 months now. So next month I gave 4. Every Sunday I gave a grant test.
Okay. So, do you think that grant tests also were a good thing to sort of tell you where you lack and what is your level and where you need to sort of indulge more as well?
Yeah, grant test quite helped me, because in exam you have just per question ICT we have just 54 seconds. You have to think in just 54 seconds. Whatever strikes your brain, you have to mark it. You don't have time to think the whole concept. Okay, what was that? What I am lagging? So Grant has helped me quite a bit. Then I understand that the first thing strikes is the correct, and if it's not striking correctly, then I have to mug up, put a little extra effort on that, so that
Yes.
it strikes in just 40-50 seconds.
That's absolutely right. और ऐश्वर्या जब हम स्पेशली INICT का बात करते हैं so we always talk about previous year questions. So I want to know what was your approach. Did you see the previous year questions at the beginning or did you do them close to the exam? You know, on the app as well in the e-medicos we've given the whole section of previous year questions, in fact with videos as well. So what strategy did you follow? Did you do them at the beginning of your preparation or did you do it close to the exam?
I did the questions close to the exam, so that I
Okay.
know that level I am standing, and so that, and also if a question directly come and I didn't understand what it is, if I remember the answer, I can mark it. And but I thought that in a previous year questions, a few questions were that, like, I thought the question is giving wrong in the exam. It would have been right. Then you recall it is they have given wrong. Then I gave the exam and I learned the fact that the question itself in the exam is wrong. There are many grammatical errors. There are many framing errors, and in some books they have given the right. It is that they have given the right answer, but in the main exam there was no right answer of that question.
Yes, yes.
To choose among the what
So,
is the best.
so it's very important that we understand that when we talk about recall, these are student recalls. Yes, and you know, instead of trying to learn the answer, you have to see what the topic is about and go to the depth of that topic because, especially in INICT, you know, they'll change one word and you'll realize that the answer changes. And sometimes, you know, the best possible answer is not in the options only. So, you know, those are the kind of twists they do in the real exam. So it's essential that you know your content well and not simply rely on sort of mugging up the answers of previous year questions. I think that's very, very important. Topics के बारे में कुछ बताना चाहोगे ऐश्वर्या कि INI में you know we always say there are certain things subjects distribution or topic distribution उसके बारे में do you want to talk something about that?
I will talk specifically that in ICT the images of Dharma are directly from the same Professor Nina Khanna's book. And I'm from AIMS. I also get the benefit that these professors are teaching me. I know that what topics they consider as important. So
That's
the images
true.
I revised just one day. Me and my friends all revised just one day back. The images directly came. We didn't even read the question. We know that this images. We have just
Yeah.
seen this. And in microbiology too, we thought that the slides that were taught to us in the classes, they directly gave the question from those slides. And in medicine, I'm talking that medicine, it's not that much important according to me. That medicine, you have to, at the last time you are doing this, you have to do medicine, understand medicine for the profs, and just read 1 to 2 times. uh, at the last time, because medicine is concept based, you can do it in the exam because based on the concept, you know. And
Yes.
even if you read the medicine at the last time, you will just get 1 or 2 question extra correct. But if you read a minor subject which has lots of mugging, like forensic ENT, ortho, and anesthesia, then there are higher chances that you will get the question correct.
So I think that's a very valid point that Aishwarya is trying to highlight, that don't ignore the minor subjects. He's saying that there's limited material, but if you do it well, they become very scoring. As far as spending the same amount of time or excessive time on very vast subjects like medicine and surgery, so they're too vast. उसमें आप कितना भी depth में जाओगे, there is still a possibility you will come across something that they can still confuse you with, right? So yes, please do not miss on the minor subjects as well when it comes to the INICT exams. Okay, and now let's talk about your attempt ratio. Okay, before I go to the attempt ratio, what exactly did you do 1 week before the exam? So we always say a week to 10 days before the exam, what you revise does play a vital role. Yes. So how did you decide what will you revise and what exactly was what you revised?
So I prepared a list of the topics that I thought that are very important. These are also as in GTs. I tend to forget, and if I remember
Okay.
like anatomy, you have to correlate with. If you remember 1 or 2 things, you can eliminate 2 options, and there are 2 options left. Then there are high chances, then you can get the other 2 options correct. If it's a question stuff. So I tend to remember, make a list of the subjects like the
Okay.
minor, all the minor subjects, and anatomy, pharma. I try to do these subjects in the last 1 week.
Okay.
And second thing was to stay calm in the last week because there's a lot of anxiety. So my mother used to
True.
tell me that जितनी मेहनत करनी थी तूने कर ली, अब लास्ट के हफ्ते से कुछ नहीं होना.
That's very
So
true.
stay calm. But a lot of things that we didn't learn in the last week came.
अच्छा, एक और चीज मुझे बताओ ऐश्वर्या, which I feel every student who's preparing has a dilemma about. Since you mentioned that we have 19 subjects and there is loads to do, how do you ensure that you're not going overboard? Because you will agree with me that we're not doing MD in 19 subjects. है ना? We initially, our goal is to crack an exam with a good rank. Obviously, we cleared concepts during MBBS, but now we want to clear an exam. So how did you sort of ensure that you're not going overboard, and how did you know to restrict yourself? What goes in your mind?
When you read plenty of time, you can read it, understand it, go in the depth because you have plenty of time. But when you're in the revision time, you can't read it the whole thing. You have to fix the limited number of days that I have to complete it in these days. And for me, it was never completed in that much days. It always takes some
Okay.
days. So I topics which were less important, so that if I have time, I will revise it. Or the more important topics were revised multiple times.
Okay.
Okay, and then if
Good.
I have time to revise the topics that were left at the last, so that prevented me from doing in depth. So make a time span, and if the topics that are left after that, you just leave the topics. So for the next subjects, if you do, you will think subconsciously that I have to do the important ones first. And in
Yes.
the INA, in the exams, you can do the recall. You can see that uh, the topics that are asked in the previous exam, they tends to ask from those topics only. So they see the common topics asking. There are few tough questions that we tend to water too much, that this was too much depth questions are we required. So as seniors used to tell these questions, these tough question, no one is going to answer these questions. You don't have to bother about them. So we used to try to leave those questions.
That's true. Okay, and कोई revision cycle था ऐश्वर्या, for example कि मैं इतने दिन में दोबारा revision करूंगा or something of that sort?
Uh, I try to. make it a revision cycle, like revise all the subjects in 1 month, but it usually will it was not completed every time. I try to make a plan, I will revise
So,
it.
which means it happens with toppers as well. So you should all be rest assured कि ऐसा नहीं है कि toppers एक schedule बनाते हैं and they're completely able to follow it. But what I can understand from him is कि फिर भी schedule बनाना बहुत ज़रूरी है so that you're not spending unusual time on one subject and your preparation goes skewed. So he also said he used to move on with the next subject. I think that's the key, है ना Aishwarya?
Yeah.
Okay, and now let's talk about the exam itself. I want to know what was your attempt ratio? How many questions did you do right? You think you got right? And any subject weightage that you want to comment upon, or what subjects are very important when it comes to INICET?
uh, I attempted a lot questions. I should not have attempted that much questions, but there was the time na ki I can eliminate two options. I have just
Okay.
two options left, so I have 50% chance that I can get it right, and the
Yes.
negative is minus 0.3. So I, by the statistic, I trained to do those questions. Either one can be correct. So I have eliminated two. I will go with this. So I attempted 196 question. I
Okay.
thought I should not have attempted that much, and I think I got around 50. 50 would have been wrong. More than
Okay.
50 wrong,
Okay. Okay.
because no one knows.
Yes,
Yeah.
I know. That is why I just said what about in India, and anything about the subject distribution that you want to talk about?
Subject distribution, it varies with the paper. This time there was more of ortho and forensic. So last time revising the minors helped me a lot.
Yes.
Less from medicine and surgery.
Okay. And which subjects do you personally think were very scoring for you?
Forensic was quite scoring because
Okay.
I think they just take the UG book and just give it from them, whatever they think.
Okay. That's
Forensic
that's
is, and yeah, the minors, if you know the basic concepts. First,
great.
second year too.
Wonderful. And what branch do you want to pursue, Aishwarya?
I want to pursue a surgical branch, but have not yet decided.
Haven't decided. But yes, that's great. At least you know what you're a medicine person or a surgery person, and I'm sure whatever branch you pursue, you're going to do great in it. Any tips that you would want to give your juniors or people who want to crack the upcoming INICT? See, there's about 6 months to 7 months left for INICT, 6 months approximately. So, what strategy would you ask or tell them that they should follow in these 5 6 months for the next INICT exam?
I would like to tell them, just believe in whatever you are reading, because in between, we try to get bothered by the questions that this was outside my notes which I'm reading. So maybe my notes were wrong.
Right.
This is a wrong thinking that that we usually think, yeah, I'm reading the wrong notes. So just believe in whatever you're reading. Read it thoroughly. Read it completely. Then yeah, but
That's great. And any piece of motivational or inspirational advice that you would want to give?
yeah, just you have to believe in yourself, and you will achieve success.
That's wonderful, Aishwarya. And we also wish you all the very best in all your future endeavors. I'm sure whichever branch you'll pursue will make a lot of difference to the branch and to the patients. And we wish you a very, very bright future ahead. And thank you for sharing the stage with us today. Best wishes to you always.
Thank you so much, ma'am.
Thank you. God bless you, Ajay.